Hey guys, Lawrence here with Laws of Physio with the back pain series, and today we're going to talk about red flags. So what is a red flag? It is something that is outside the scope of our practice. So that means that it is symptoms that we look for when people come in with back pain, and usually it means there is something more serious, and it's usually something we can't really help you with, so we refer you on to someone who can help you. So we'll go through it slowly. The first one is, all the info is right here. Spinal compression or cauda equina. The main thing we look for is, do you have any issues going to the bathroom? So are you having any issues contracting or pushing either through the front or the back? Are you getting any numbness, any pins and needles, or any tingling in your genital area or your back area? And that's usually a sign of spinal compression, and we normally have to refer you on to get a scan to make sure, or refer you to a specialist to look out for you there. Next one is a risk of infection. So sometimes when you get the cold flu, your whole body aches, feels kind of gross, you don't want to do anything, you don't want to move. So signs include a fever if your temperature's high. Do you feel unwell? Do you have flu-like symptoms? Have you been exposed to someone with any kind of infectious disease? If you do, we normally send you off, get a blood test just to make sure that you're okay and get you properly medicated for that. Next thing would be a fracture. So if you break your bone, that is what we call a fracture. So with that, if you've recently been in an accident or you've had any kind of collision, a fall, you've been in a tackle, a car accident, if you have any history of osteoporosis, so if you have brittle bones, then you're at higher risk of breaking them. Usually when we feel your bone, if we feel anything that's really abnormal or it's extremely painful, and you can't really move, then usually we'll send you off to get a scan and get a second opinion from a doctor. From there, we either put you on a cast or we have to manage it in a different way. Fourth thing is ankylosing spondylitis. So this is an inflammatory disease. So it's most common with men between the ages of 15 and 35. Signs we look for is night pain, so not really getting much sleep, it's constant pain. You get that 1 hour long morning stiffness, and it's just not indicative of any other issues that we've come across. So when that comes around, then we send you off to the doc, possibly do a scan, or we do some blood tests to check your inflammatory markers and make sure that everything's okay. And the last thing that we need to screen for is the possibility of cancer. So if you've had any dramatic weight loss in the last few weeks, if there is constant 24/7 pain and nothing's fixing it, if you've got a history of cancer, those are usually the red flags that we look for to refer you to someone who can look after you. So what should you do if anyone with that comes into our clinic? We usually write a referral to a doctor or write a referral for a scan, send you off, and just pray that none of that is true. So another common question we get is, do you need a scan before coming into physio? And I'll answer that in the next one. All right.